The trigeminal nerve arises from the lateral aspect of the pons comprised of a primary sensory nucleus, mesencephalic nucleus, motor nucleus, nucleus of spinal tract. The first branch, ophthalmic nerve, arises from the trigeminal ganglion, passes through the lateral wall of cavernous sinus and gives 3 branches: the lacrimal nerve, which passes through the upper part of superior orbital fissure, the frontal nerve, which passes through the middle part of superior orbital fissure, and the nasociliary branch from the lower part of superior orbital fissure. The frontal nerve has 2 branches, supraorbital and supratrochlear. The nasociliary gives a branch to ciliary ganglion, then gives a branch to posterior ethmoidal, anterior ethmoidal, and an infratrochlear branch. The anterior ethmoidal has 3 branches: internal nasal, medial, and external nasal. The maxillary nerve is the second branch and arises from the trigeminal ganglion, passes through the lateral wall of cavernous sinus and exits the cranial fossa through foramen rotundum. Gives a branch to the pterygopalatine ganglion, which itself gives branches to greater and lesser palatine nerves. Orbital, messiah nasal, lateral nasal. The maxillary nerve further give branches to orbicularis oris, zygomatico-facial, zygomatico-temporal, posterior superior alveolar, middle superior alveolar, and anterior superior alveolar. Then it passes through the infraorbital canal and divides into infraorbital nerve on face. The mandibular nerve is the third branch, and after emerging from trigeminal ganglion exits the cranial fossa through the foramen ovale. And the mandibular nerve is divided into 3 parts: the main trunk, anterior and posterior divisions. The main trunk supplies the medial pterygoid, gives a branch to otic ganglion, which has a meningeal branch and is called nervus spinosus. Supplies the tensor tympani and tensor veli palatini. The anterior division has 4 branches: deep temporal nerve, bivalve, lateral pterygoid, and masseteric. The posterior division gives a branch to lingual nerve, to which submandibular ganglion is related. The inferior alveolar nerve, which divides into mental nerve, mylohyoid nerve, and nerve to anterior belly of the gastric.